Recently, I've been learning a lot about IIH, Idiopathic Intracranial Hypertension, meaning a buildup of pressure of the cerebral spinal fluid over the brain. Did you know that the spaces in your brain are called ventricles, and they produce a clear watery fluid called cerebral spinal fluid? And this moves over the skull, over the brain, and down the spine in a closed pump system. We're not sure why it doesn't drain and why the ordinary systems are not doing their work. But these patients suffer from immense headaches, this incredible pressure. The ladies I've met have been going for lumbar punctures to drain cerebral spinal fluid. It's extremely painful. Sometimes it's really effective and sometimes it isn't. So what we're doing now is we're working with the cranium and figuring out how to get all these tension patterns down the neck, down the skull, all the way down the back, and how we can relieve that to prevent the severe pressure over the skull, which makes life really hard to live. For patients looking for a less invasive treatment or an accompanying treatment, CranioSacralFascial therapy is profound in holding gently over the skull, along the sutures, and focusing on the different lymphatics of the brain, and with a very light technique, improving that circulation so the drainage moves down the body, and scar tissue along the spine is also freed up. And this frees up the movements of the cerebral spinal fluid over the whole system, and particularly the neck and brain. It's effective, it's gentle, and patients usually get up off the table and feel the difference straight away. That relief in the head of being free of that extreme pressure is profound. And then as they start moving around in the world, their bodies can recalibrate and update to a more pain-free existence, and getting that pump moving, getting that cerebral spinal fluid moving over the brain and body.